Welcome to Health, Wellbeing and Lifestyle, where professionals in the field educate, inform and inspire the community to live a more balanced and healthier lifestyle they love. Our first guest today is naturopath, respiratory specialist and published author Julia Rudakova, and she will be talking with us about children's respiratory health. Welcome, Julia.
Thank you. Thank you so much for having me here today.
So what are some of the common children's respiratory health issues?
Well, I see a lot of children in my practice, and most often parents bring their kids with tonsillitis, recurrent coughs, and of course asthma. Asthma is one of the top conditions that I see children for. And what is asthma? Asthma is constriction of airways, really. And the body, when it does that in response to a trigger, it can be an emotional trigger, it can be a chemical trigger, can be viral. There is a physical activity-induced asthma. And when that happens, body starts producing mucus as well to safeguard itself, to expel the trigger and to moisten the airways. So it's a very, very natural response of the body. There is no pathology is that. When that happens, it's the body doing its work, protecting itself. Although it seems and sounds and looks terrible to observe your child struggling to breathe. Another common respiratory condition that I see in kids is anything to do with tonsils, adenoids. So they are lymphatic tissues that are located at the back of the throat in the nasal passage, and they are immune tissues. They're lymphatic immune tissues, and it's not uncommon for young children to go through that because their immune system is maturing, and that's quite normal if it becomes a pattern. And if they get recurrent tonsillitis and enlarged adenoid to the point of not being able to breathe for months on end, then we have an issue and we need to address that. But from my perspective, the thing is that even when all the tissues are cut out, all adenoids gone, tonsils are out, what happens, what I observe is that they still breathe through the mouth. They can still snore. They may have initial adjustment and parents are happy and there is an improvement, but then they go back to the pattern, to the original pattern of mouth breathing, and that's not helping their dental health, their emotional health. Children wake up tired, and that's the worst thing, because children by their nature are very energetic. They have so much energy. They need energy to grow, to develop, to grow bones, to multiply cells, and for the brain to develop. And when they lose that, it sets them back. So it comes down to retraining the receptors in the brain, and that's where we use the Buteyko technique.
So can you explain to us what is the Buteyko technique? How does it work?
So it was developed by the late Dr. Buteyko many decades ago, and originally it was used for cardiovascular disease, but then it was trialed for asthma and respiratory disease because it is to do with your lungs and bronchi. And what it does, it teaches the body, again, reteaches, the body has to relearn how to breathe in a more functional way. What does that mean, to breathe in a more functional way? So there is a certain breathing rate that we aim at, and it's about 6 to 8 breaths per minute. So 6 to 10 maximum breaths per minute is our optimal range, right? So it's a slow breathing. It's gentle, so when you sit next to someone, you ideally shouldn't be able to hear them breathe, right? Sometimes it's very audible, our breath. Yeah, you sit to a person at the table in a cafe or at a function and you can hear them breathe. So that's not something that we call functional. The next one is how we breathe. Do we use the nose or the mouth? Right. So with the mouth, if you look at the hole here and here, mouth is much bigger. So we lose more important gases such as carbon dioxide, which is the driver to breathing, not oxygen. So Buteyko technique, what it does, it teaches us to go back to the original blueprint of the healthy breathing. The rate, what organs we use, what muscles we use to breathe, so the diaphragm instead of the chest, nose instead of the mouth, and proper breathing rate, and how we breathe, gentle or forceful. So that's in a nutshell what we do with the functional breathing retraining.
So what would be your advice to parents with kids who have respiratory health issues?
My advice would be to go back to the fundamentals and address their breathing patterns. It's super important, as I said before, to optimize the results of their treatment. And they can start with observing their child's breathing, and when they notice that the lips are slightly open, even if there is no audible breathing through the mouth, but the lips are slightly open, it means that the child is losing certain chemistry. And what they can do, I always say, they can say, close your mouth, but it becomes repetitive and annoying. So what I always say, just find a word like a giraffe and have this game with a child. When you say the word giraffe, it means that they need to close the lips and close the mouth, and that pushes the body to breathe through the nose. So re-establish nasal breathing at all costs is my tip. And of course, we need to go and seek help of a professional naturopathic practitioner or any medical practitioner and get a proper assessment and a proper plan.
Thank you so much for your time, Julia. If you'd like to know more about children's respiratory health issues and Julia, you can visit her webpage on our website, healthwellbeingandlifestyle.com.au. Stick around, because after the break, we'll be back with another guest and another interesting topic.
Stay tuned. After the break, naturopath, lecturer and author Michèle Wolff will be talking about, are bloating and irritable bowel syndrome curable? Welcome back. Our next guest, Michèle Wolff, is a naturopath, lecturer and author, and the topic we'll be discussing is, are irritable bowel symptoms curable? Welcome, Michèle.
Hi, Megan.
So, what is the cause of irritable bowel symptoms?
It can be many causes, and I'll also just describe the symptoms because they can be very varied. So irritable bowel is a broad term that can cover alternating constipation and diarrhea, bloating, excessive wind, and pain and cramping in the gut. Some people may be diagnosed with irritable bowel and tend more to constipation, others may have diarrhea. So there can be several different symptoms involved. Yes, it's definitely curable once the cause has been found. So there's lots of different causes to irritable bowel. So it can be, for example, a type of pathology, which could be an overgrowth of bacteria, abnormal bacteria, like streptococcus or enterococcus. It could be an overgrowth of a parasite. It could be overgrowth of a fungus. It could be an intolerance or an allergy to a particular food. It can be simply stress that causes it, or a lack of a nutrient that is used up due to stress, like magnesium, which is a relaxant to the gut. And it could be due to a lifestyle where there's, for example, a truck driver who sits for hours, or somebody that has a lot of shift work and they're changing hours. That can cause problems with the gut and a lot of discomfort and bloating. And it can be something more serious that needs to be investigated. Like people can have bloating when they've got ovarian cancer. That's an extreme example, but these things are not to be overlooked. So I would normally ask a lot of questions to define what I think that the cause is. And there can also be a problem with the upper digestion. So if somebody's not producing enough digestive enzymes or bile from their gallbladder or hydrochloric acid, or they've got small intestine bacterial overgrowth, which is higher up, then that can lead to irritable bowel symptoms as well. So it's quite varied, but they can all be cured if they have the right medicine.
So irritable bowel is curable?
Yes, it's definitely curable. So once we found out what the cause is, if you're intolerant to wheat, it may be taking the wheat out, allowing the bowel to heal, giving specific herbs and remedies, and then there may be a time that you can bring wheat back in, as long as there's not something more serious like celiac disease, which can cause irritable bowel as well. That can be masked as it as well. If there is a parasite infection diagnosed, then we will use specific herbs for specific parasites. So we may use wormwood or garlic or Artemisia annua, black walnut, there is a pomegranate, there's a whole range of herbs depending on which parasite there is, and the herbs need to be tailored by a naturopath. I wouldn't go out and take them yourself, because it's a certain amount of meals and the prescription is quite defined. If it's a fungus, we would use herbs like golden seal podarco, horopito, to name a few, and they would be given for a certain amount of time along with a diet that starves out fungus, and along with correcting the microbiome. So just like you have healthy soil with good healthy bacteria and then your plants grow really strong, we want to have healthy flora and fauna in the gut, and then the parasites don't come in the first place. Also, if you've got really healthy hydrochloric acid in your stomach, that's one of your first lines of defences. So if somebody has a lettuce leaf with a parasite egg on it, and they chew that, and you've got good amounts of hydrochloric acid, that will kill it off in the stomach. If they don't, then it passes into the bowel and then can hatch into a parasite. So it's having all the defences in place. Also, the intestine is 70 to 80% of our immune system. So we want that to be really healthy so that the immune system also fights off things like fungus and bacteria and parasites. So it's all curable through lifestyle and through managing stress, through certain herbal medicine and certain nutrients, and guidance with lifestyle practices from somebody like myself. And if I think it's something more complicated, I'll refer to a doctor.
That's such good information, thank you. So do you have any extra tips for our viewers?
Yes. So if you're having something bitter or sour with most of your meals, you'll be helping to stimulate your good digestive juices, which is preventative for a start. Eat calmly, eat sitting down, avoid eating when you're stressed, because that can lead to more bloating and more irritable bowel. And it doesn't hurt to miss a meal or two if you're really stressed. Just wait till you're really calm. Obviously, if you're ongoingly not nourishing yourself, there's a problem. But a few hours or a few days is no problem. Having the spices which I have mentioned before, like fennel, ginger, cardamom, peppermint as digestive spices to strengthen the gut, really helps. And if you're going overseas to a foreign country where you may pick up a parasite, take a really good non-refrigerated probiotic with you and ask your naturopath what you can take with you to both prevent and treat parasites, so that you can sort of knock it on the head quicker. And then if you're living a healthy, balanced lifestyle with good food, lots of rest, good fluid, healthy relationships, then your own system will be in balance to ward these things off. Sometimes it's when we get out of balance that we get more prone to things like irritable bowel.
That's such valuable information, Michèle. If you'd like to know more about Michèle Wolff and irritable bowel symptoms, please go to Michelle's webpage on our website, healthwellbeingandlifestyle.com.au. And after the break, we have another interesting guest with another interesting topic.
Stay tuned. After the break, Lifestyle GP Dr. Avi Charlton will be talking about the health benefits of functional breathing. Welcome back. Our last guest today is Lifestyle GP Dr. Avi Charlton, and we will be talking about the health benefits of functional breathing. Welcome back.
Thank you for having me again, Stephanie.
Dr. Avi, what is functional breathing and what are the health benefits of it?
To understand functional breathing, we've got to understand dysfunctional breathing. Dysfunctional breathing means not breathing properly. What happens is if we don't breathe properly, we can get more anxious. We suffer from palpitations. And if we use our mouth to breathe a lot, then we yawn a lot and we feel like we need to take big breaths all the time. We feel like we're not getting enough air. We feel short of breath. What happens when people don't breathe properly is they might not sleep properly as well. Sometimes some people snore and then they use their mouth for breathing rather than the nose for breathing. Then they don't sleep well. They wake up not having enough energy and it becomes a vicious cycle. Then they don't breathe well during the day. They feel like they're short of breath. They feel anxious and they don't have enough energy to perform in the day-to-day activities. There's signs that can tell you that if you're not breathing properly, you might yawn, you might feel short of breath and you feel like you're gasping for air. Sometimes you get palpitations or even reflux.
How can our viewers use breathing to improve their health?
So there's a few little things and then there's a few breathing exercises that we can do. What we can do is we can practice breathing light, breathing slow and breathing deep. So I'll elaborate each tip. Breathing light means we don't take big, huge breaths all the time, and practicing breathing less amplitude breathing, light breathing. What that can do is that can tell your body to hold more carbon dioxide, and there's a little bit of science to it that it actually tells your oxygen to get into your body, the brain, the muscles more. So light breathing improves our carbon dioxide tolerance. Deep breathing means we practice breathing into the diaphragm. What we can do is we can practice getting our hands to feel our rib cage. If we breathe into our rib cage, our ribs will come out and then our belly will go out. As we breathe out, our rib cage will go in and our belly will go in. So we practice deep breathing into our diaphragm as feeling our rib cage go out. So there's breathing light, breathing deep, and breathing slow. So what we can do is we can practice slowing down our breathing. We can do breathing exercises that involve slowing down. If you're new to this, you can do counts, breathing in for 3 and out for 3, breathing exercises. Then if you get better at it, you can breathe in for 4, out for 4, or even in for 5 and building up to as long as you can, as you tolerate on breathing exercises. Then there's breath holding exercises that you can slowly incorporate into your life. There's a technique called box breathing. Box breathing means that you take a breath in for 4 counts and then hold for 4 counts and then out for 4 counts and then hold again for 4 counts. And then if you can do 4 counts, you can increase it to 5 counts or even 6 counts. This technique is used by the Navy SEALs to slow down their anxiety, calm them down, and that can improve their mental health. That helps to improve our breathing and reduce anxiety, improve our well-being as well. Then there's lots of other breath holding exercises that we can practice. Let's say you're going out for a walk, you can do some breath holding. If you're new at it, you can hold, pinching your nose for 10 steps, and then you can release and walk 10 steps. Then you can repeat it again 5 or 6 times, doing breath holding exercises. As you get better, you can increase it to 15 steps or even 20 steps. Then that helps to tell our body that we can hold on to carbon dioxide more. Then your body can learn to tolerate higher carbon dioxides. That actually gets your body, your muscles, and your brain to have more oxygen delivered. That in turn improve your mental health, improve cognition, and you function better. The more we breathe through your nose, the more you breathe through your nose at night when you're sleeping as well. We also talk about using mouth tape to tape your mouth so you don't breathe through your mouth at night, especially for those who don't know if you're breathing through your mouth at night. And some people worry about that they will suffocate if they're breathing through, if they have their mouth taped. There are lots of different mouth tapes. Some of them have a little slit that doesn't cover their mouth, and that might help you to get used to a mouth tape and practice breathing more nose breathing. In turn, that can help with better sleep and better function during the day. With children, what happens if the children breathing through their mouth is they can get facial development problems. If they breathe through their mouth too much, the jaw development isn't quite right, and they can get facial development problems, receding jaws, and they're more likely to need orthodontic treatment, braces. So what parents can do is they can remind their children to breathe through the nose more often, all the time. And even at night, they can mouth tape the kids. They might have to get used to it, and you can get special mouth tapes that has a slit in the middle. And there are exercises called buteyko exercises that their mothers can do games with the children, practice more nose breathing and even breath holding. What I suggest is people can seek help with professionals who are trained in breath work and breathing exercises, who talk about how to breathe functionally. So we can get the right guidance to talk about functional breathing, get the right exercises for breath work. In that way, you can get the right advice on how to breathe properly.
Great. I'm going to be checking my breath for the rest of the day.
That's great.
Thank you for that information.
Thank you, Stephanie.
If you would like to know more about functional breathing and Dr. Avi Charlton, please visit her webpage on our website, healthwellbeingandlifestyle.com.au. That's all we have time for today. Goodbye until next week.
If you'd like to know more about our show, please like us on Facebook, follow us on Instagram, and subscribe to our YouTube channel.